Well, hello everyone. Welcome to another Fun Fact Friday. We are here in our x-ray suite because we just got digital x-rays and we are getting all the training we need to make sure we can take some perfect images. So I thought I'd start there for you guys. But let's get back to our normal Fun Fact Friday, shall we? In honor of our new digital x-ray machine, I thought we can talk a little bit more about x-rays themselves, what we use them for in veterinary medicine, some of the pitfalls of x-rays because they're not perfect. No imaging is, and how they benefit us as doctors. So as doctors, we of course can't take an exam, doesn't get into the middle of the animal, right? We can feel things in the abdomen, we can feel for masses, we can find a lot of things out with just our exam in our two hands, but those x-rays are really just a great added bonus for us to get an image inside our animal. We can take chest x-rays, look at the heart, look at the trachea, the lungs, all of those internal tissues there. We can even take x-rays of the abdomen, looking at the stomach and the liver, kidneys, intestine. That is a really big one that we use them for, is intestinal foreign bodies. Your dog accidentally ate a sock. That's what we're going to use to find that out. We can look at bone. We can look at hips and knees, spine. We can also do skull x-rays, although that's where some of our x-rays aren't perfect. Another fun fact about x-rays is, and a lot of big questions we get is, why do we have to take more than one view? Why can't we just take one shot? We got what we need, we're good to go. And so part of the thing about x-rays is that x-rays are a 2D image of a 3D object. So when you're looking at an x-ray this way, you've got one image, right? My hand looks like a circle with an opening. When I look at it this way, it looks quite different. And so when we're looking at things on an x-ray, it may look very different from one view to the next. And so getting at least two views, and depending on what we're looking at, sometimes things like heart and lungs, 3 views really tells us the whole story about what's going on. The other thing that is a misconception about x-rays is that we can just see everything in an x-ray. And unfortunately, x-rays are really amazing at bone and things like that. But when we're talking about soft tissue things, the squishy things, that can be a little bit more difficult. So when you're looking at, can we just see this mass in here? Unless it's large, we might not be able to. But for bone, arthritis, fractures, those kinds of things, x-rays are perfect for. When we're looking at more kind of internal structures to the kidney or the liver, ultrasound and sometimes other modalities like MRIs might be a better option for those types of things depending on what we're looking for. So our imaging and what we're using really depends on what we're needing to look for. But x-rays are a great place to start. Another thing that I love using x-rays for is for serial checks. So when we're talking about checking our older patients, how has our arthritis changed as I've gone from 8 to 10 to 12 years old and watching that progression? Heart disease, checking the size and shape of our heart, and again, how does that progress? Looking for fluid on the lungs. Maybe we had a lot at one point, we've treated with medications now, and then we recheck again. But x-rays in an older patient can tell us so many things, so getting them as part of your yearly exam is so much more important than we used to think. And getting a negative x-ray, so getting an x-ray that says we didn't find anything, a lot of people feel like, that was kind of a waste, but getting an x-ray where there's nothing in it tells us so much. We know that everything's good. Our liver is fine. Our spine is fine. We don't see any evidence of arthritis or fractures, an obstruction, all of those scary things. So getting a negative x-ray can be just as important as finding something specific on an x-ray. And so we are excited here to now be finally digital. It gives us so much more free of use when we're talking about sending our x-rays out to a consult from a radiologist, to send them to other hospitals. We have a lot of snowbirds that may travel between us and a northern veterinarian, as well as just the crispness and how perfect the image is so much better on a digital x-ray versus film. So we are very excited here and can't wait to continue our x-ray journey with our new equipment. If you have questions or concerns about x-rays, what to use them for, what you might be looking for a problem in your patient, feel free to message me here at University Animal Clinic. I will try to answer them as best I can. If you have an idea for another Fun Fact Friday, something you'd like to learn more about, you'd want me to discuss a little further, leave that down in the comment section below too. I always want to talk about what you want to learn about. We're on YouTube now too, so if you can't view this on Facebook or are having some issues, these videos will be being loaded up on YouTube. Tell your friends that might not be on Facebook that that's where they can get more veterinary information, is on our YouTube channel. And we look forward to seeing you next Fun Fact Friday. Like and share this video with all of your friends. We'd love to see you next time. Thanks.